Well, good afternoon again. So, thank you very much for everyone who's joining us. And we have Matt Campbell here, and he's going to talk about the new Midwest Concussion Clinic. And we're going to just turn it over to him so he can have the floor and um, really just give us more of a comprehensive view of what this new concussion clinic looks like.
Great. Well, Lucas, again, thanks for having me. Thanks for setting us up. Again, for those of you that don't know who I am, my name's Matt Campbell. I'm the clinical director of the Midwest Concussion Clinic. I'm a certified athletic trainer, graduate of Indiana University back in 2013. And really, I'm just an athletic trainer that has a passion for concussions, concussion management, and concussion recovery. I just wanted to meet with everybody today and kind of sit down and talk to you guys about what we have done. Currently, and it's exciting to announce that we are the Midwest Concussion Clinic. We are an independent concussion clinic here in Fort Wayne, serving the Fort Wayne and Fort Wayne areas. We are a research-driven and state-of-the-art concussion management company. We use a team of concussion specialists to diagnose and treat the complex injury of concussions with precision and care. We treat everything from acute concussions, persistent concussion symptoms, and post-concussion syndrome, vertigo and vestibular impairments, patients that have suffered motor vehicle accidents, falls, domestic violence, as well as baseline concussion testing and return to play testing if needed. I just kind of want to give an overview of what we do and who we are and where we are. And then want to open it up for any questions. If anybody has any other meetings that they want to set up, we can go with that route and talk about specifically with your company or with your school, how you want to handle, our relationship moving forward. We started back in September as a concussion clinic with physical medicine consultants. Dr. Lazoff is our medical director. He is a physiatrist here in Fort Wayne. He's been treating head injuries for workers' comp cases for the last 5 years or so. And he finally approached me back in September and decided that we needed to come up with something to where he could refer his patients to instead of just, hey, let's wait 2 weeks and see how it recovers. Back in April, we rebranded and became an independent company. So we are the Midwest Concussion Clinic, powered by the Doctors of Physical Medicine Consultants. What we do as a clinic is we take all of our patients in, we go through everybody from, that initial phase of concussion recovery all the way up to, long-term persistent concussion symptoms. We bring everybody in, we do a quick evaluation on them. Our evaluation consists of a SCAT-5 test, the gold standard in concussion testing. We do the VOMS assessment, so the vestibular ocular motor screen. We put everybody through cranial nerve testing and a full cranial nerve assessment. We test their balance using the modified clinical test of sensory interaction and balance. It's a easier test to complete than what maybe the best test you've all heard of. We also put our patients through the Buffalo concussion treadmill test or the Buffalo concussion bike test, depending on their vestibular impairments and any other soft tissue lower extremity injuries that may impair their ability to walk on a treadmill. We take all of these tests, we monitor heart rate, we basically take a comprehensive look at the patient as a whole during our initial evaluation to determine and to establish a treatment protocol that's individualized for each patient. So we aren't rolling out a cookie cutter approach. We aren't rolling out, hey, let's go sit in a dark room for 2 weeks and see how it goes. Concussions are now a real hotbed topic in the media. Research articles coming out, they're expecting anywhere from 40 to 60,000 research articles to come out in the next 2 years on concussions and persistent concussion symptoms and concussion rehabilitation as a whole. So we are a constantly evolving company that looks at the complex injury as a whole and starts to piece by piece treat each individual area to establish a full concussion recovery. Ideally, we like to see our patients within that first 24 to 48 hours following the initial injury. Again, with persistent concussion symptoms and post-concussion syndrome, a lot of times, if I see somebody in our clinic for that PCS, the earliest I've seen is February, right? So we're looking at 4 to 6 months, 6 to 8 months, 3 years We treat everybody with the same initial testing to determine our individualized program moving forward. What we do as a clinic is kind of a new understanding and a new ideal way of looking at concussions. Within the last 18 months, our entire understanding of concussions and concussion rehab has completely changed. It used to be the full sit into a dark room approach and not do anything for anybody, but it's evolved into early intervention training, and early intervention rehabilitation actually improves the outcomes for our patients, whether it be no lingering symptoms, full recovery, full cognitive recovery. The earlier you can get into the intervention, the better outcomes your patients will have. So that's what we're trying to do. You know, we saw a gap in treatment in a lot of places. As an athletic trainer, you know, I'm on the front lines of concussion management, concussion identification and diagnosis. So when it came down to what's lacking in our concussion coverage, it's something that I was able to see firsthand and use it as a unique way of developing our Midwest Concussion Clinic. Once we go through the entire concussion testing and evaluation with me, Dr. Lazoff comes in to do a neurological workup and a full evaluation. And as long as he and I are on the same page, we establish our treatment plans moving forward. The individualized aspect of our concussion clinic is something that's unique to not necessarily just to our clinic, but unique to the new situations of concussion rehab. You see it all over the place in sports medicine, athletic training, physical therapy, orthopedics. The cookie cutter approach is no longer applicable. It's no longer something that is being thrown out, and it's evolving in the ways of all orthopedic injuries, let alone, you know, concussion recovery and concussion management. So it's something that we take into consideration. We're constantly evolving our approach. We're reviewing new research articles, looking through new treatment protocols to come up with the best way to safely treat our athletes. So with our concussion clinic, we treated everything from youth sports all the way up to elderly adults that suffering from falls, motor vehicle accidents, like I said, sports-related concussions. We don't specialize in only athletes. We treat the general public. We've had collegiate athletes. We've had professional athletes. You know, we've seen a wide variety of patients, which makes it, again, one of those things that we see a multitude of reaction and a multitude of recovery phases within the different populations that allow us to generate different protocols and treatment plans moving forward. We partnered a lot this last fall with high schools and colleges in the area, and it was a unique partnership because we were able to establish individualized, you know, relationships with the university that we worked with. You know, we've worked with Purdue Fort Wayne, we've worked with Indiana Wesleyan, we've worked with Taylor University, Grace College. I've been to Manchester's athletic training program to present a couple of different times. It's something that has worked out very well for us. So I wanted to reach out to the athletic trainers in the area and try to establish, one, that we are an independent concussion clinic, and two, just wanted to get out in front of you guys to let you know that I'm here to work with you for whatever you need, whether it's us treating patients, concussion education for staff members, concussion education for parents, coaches, administration. We're a multifaceted concussion clinic. So the treatment of the concussions and treatment of patients is one area that we really focus on. The education and the growing and evolving of healthcare providers, physicians, optometrists, physical therapists, chiropractors. It's something that we want to work on, educating a wide variety of healthcare providers, parents, athletes, grandparents, general public on the updates in concussions. Because a lot of times, you know, we see patients come in, I have a concussion, now what? Or there's all this research information out there. There's all these news articles out there. Patients come in scared. You know, my son or daughter just suffered their first concussion. Does that mean they're going to have CTE for the rest of their life? So getting out in front of them and developing and establishing that relationship where we want to be the concussion, one of the concussion specialists in the area that works as a team with the athletic trainers, works as a team with other physicians to establish a full quality of care and a full concussion care team for our patients. I've talked to a couple different schools about setting up meetings with guidance counselors, meetings with the athletic training staff, nursing staff, to establish channels of communication and care throughout the entire concussion recovery for students, to make sure that we're treating the students on the entire day. I read a research article the other day that talks about when you're treating concussion or concussed patients, or patients suffering from persistent concussion symptoms, you're treating 1 to 2 hours of the day. What do you do with the other 166 hours of time throughout that? So we really want to educate our patients. We really want to educate all members of the concussion care team to make sure, one, the treatment that we're providing, the information that we're providing for everybody is on the same page. And two, it's an accurate way of representing the injury itself. One of the big focuses we've gone through with our coaching education is, how do coaches help the recovery process for athletes? It's different at every level. Youth coaches, high school coaches, college coaches, professional coaches, everybody's got a different relationship with their athlete, different ideals and different ways of looking at concussion and concussed athletes. What we try to avoid from coaches is that concussed athlete doesn't matter to us because they're concussed. They aren't playing, so they're not helping me. That drives concussion recovery down faster than anything else, is the fear, anxiety, and depression associated with losing my spot, losing my identity as an athlete. So the education side of our clinic is huge in terms of just establishing, what to expect with concussed athletes, how our protocols are kind of differing from what we've seen in the past. This fall, when we were talking with athletes and coaches, when we started early aerobic exercise in concussion recovery, that was mind-blowing to people, because the original treatment plan was always sit in a dark room and don't do anything. No cognitive function, no stimulus of any kind. We're just sitting there hoping to recover. And then when we don't recover, come back and see me in 2 weeks and we'll do the same thing until we get better. So that's kind of what we do as a whole. We look at, each individualized case and each individualized patient. A big thing that I like to tell our patients is, when you've seen one concussion, you've seen one concussion. Even if it's on the same patient, each concussion is going to be different. Each concussion from patient to patient, demographic to demographic, athlete to athlete, sport to sport is going to be significantly different. So we treat each individualized case with a unique program that encompasses their specific impairments, as well as the emotional side of things, the psychological side of things that may affect their concussion recovery. So basically, at the end of the day, I wanted to reach out to everybody, let you guys know that we're here. I'd like to establish a follow-up one-on-one with different sports medicine programs around the area, different doctors' offices, clinics, affiliations, to kind of, one, sit down and talk about where we may differ from what's been done in the past, and two, establish open communications. That way, if we see an athlete from your school and I give you a call, one, you know who we are, and not just we came to you out of the blue and started talking to you about concussions. And two, I want to sit down and kind of see how we can work together and individualize our relationships and how we can best help you. I'll send an email with a flyer and my contact information to Lucas to disseminate throughout, anybody who's interested. I'll also send an email and reach out to everybody to make sure that you guys all, understand where I'm coming from, answer any questions that you guys may have. But the big thing is we're here to help. We want to make sure that we are treating a very complex injury with the best information possible, with the best course of treatment possible, and establishing the best open lines of communication that we can. Does anybody have any questions about what we do or who we are? Okay, great. The last thing I want to leave everybody with is we just enrolled a social media campaign. If you guys want to follow us on Instagram and Twitter, our handle is @MW Concussion. We're looking at putting out infographics, articles, research, just generalized concussion facts to help educate the population as quickly and as widely as possible to have the most accurate information on concussions out there. If you're on Facebook, our Midwest Concussion Clinic has our own Facebook page. It's a way of contacting us with any questions. It's a way of scheduling. It's also a way of opening communications between parents, athletes, our doctors and physicians' offices, as well as our clinical coordinators and everybody in our concussion team. But if nobody has any questions, Lucas, that's all I wanted to do today. I appreciate, again, you giving me the platform to talk. I look forward to, continuing to get the message out there and continuing to meet with everybody and sitting down and seeing how we can help your companies.
Well, thank you everyone for joining us. I'm going to go ahead and stop the recording now.